Hi there, I am Dr. Monica Blied. I'm a licensed clinical psychologist in Southern California, and you can learn more about me on my website at www.drblied.com. Today, I am partnering with Lupus LA to share a free chair yoga workout video or workout exercise live. So I'm so excited that you guys joined me. Feel free to grab yourself some water before we get started and get in a comfortable position in a chair. This is chair yoga. Ideally, you have a chair that doesn't have arms so that when we do our side twist, you can maneuver and move your full body. But if not, then that is okay too. I am right here with you. So a little bit about me, as I mentioned, I'm a licensed clinical psychologist in California, and I am an 8-year lupus warrior. I was diagnosed with lupus in 2012 and later with fibromyalgia. And so I bring a lot of my personal history into my work with clients. I provide therapy for folks who are living with chronic medical conditions, as well as testing, ADHD and learning disorders testing, to help folks, in particular college students, get the accommodations that they need. So, enough about me. Let's get started. Before we start any physical workout, I would like us to learn about diaphragmatic breathing. Diaphragmatic breathing, or slow belly breathing, is the healing breath. That is the breath that is going to allow you to activate your body's parasympathetic nervous system, which is the branch of your autonomic nervous system that actually helps to relax the body. So when we think about the stress system or the sympathetic nervous system, and then the relaxation system, the parasympathetic, one is fight, flight, or freeze, and then the other is rest and digest, feed and breathe. And so by doing our slow belly breathing that we're going to learn together today, you will be able to activate your body's relaxation system, which is actually going to help improve your immune system, improve your body's ability to fight off diseases, to help to manage your health, also to manage your stress, to manage blood glucose and so many other things, and just to calm down and help to chill you out. So let me show you how that's done. I'd like you to put one hand on your belly. Okay, right or left, it doesn't matter. And I want you to take a deep breath in. And when you breathe in, I want you to breathe in through your nose. And you're breathing in through your nose as if you're smelling a bouquet of roses, or smelling the most incredible dish that you love to eat. So go ahead and breathe in. And then when you breathe out, I want you to breathe out through pursed lips. So breathing out as if you're blowing out birthday candles, or you're blowing on a wishing flower, and you're just letting the little thistles go in the wind. So go ahead, breathe in and breathe out. And did you guys notice something? When I breathe in, my belly goes out. And when I exhale, my belly comes back in. That's how we know that we're activating the diaphragm muscle. And again, that muscle is going to help to activate our body's relaxation system, and that's that healing, cleansing breath. So practice that a couple times with me, and we're going to do this slow belly breath, or this diaphragmatic breathing, throughout our entire workout today. So go ahead, breathe in and out. Smell the roses. Blow out the birthday candles. Now, if you find yourself getting dizzy or lightheaded, that means that you're not exhaling enough, or you're inhaling too much. And remember, when you breathe in, it's like blowing up a balloon. You don't want to put too much air, and then that balloon will pop. So just breathe in enough air, comfortable, but then breathe it all out. Let it all go. All right. Now let's get started, now that we've done that breath work. And we're going to end our workout today with some more breath work and perhaps some guided imagery if we have enough time. Now, if you guys have any questions as we're going along, feel free to pop those in the chat box, and I'd be happy to answer them at some point. All right, so as we get started, I want you to, again, get in a comfortable position. And as you're seated, your back should be upright, not against the back of your chair, but also not arched forward, just in a comfortable position. Your head should be right above your shoulders as if you're a puppet and someone can pull the puppet string. And then your knees are right above the area of your ankles, and your feet and your toes are pointed straight forward. Okay, so in this position, go ahead and take a few of those slow belly breaths that we just learned. In through your nose and out through your mouth. All right, next time you breathe in, as you inhale, I want you to lift your head to the sky. Take a breath here, and then exhale, and go down, chin to chest. Take a breath. Inhale, chin up to the sky. Take a breath. Exhale, chin to chest. Okay, one more time. We're going up, chin to the sky, and then down, chin to the chest. Now that your chin is down here on your chest, what I want you to do is roll your head around in a half circle. It's a pendulum swing or a half moon. So go ahead and roll until you end with your right ear above your right shoulder. Okay, take a breath. And then roll back. Left ear over left shoulder. Take a breath. Roll it back. Right ear over right shoulder. Now this time we're going to lengthen this stretch. So I want you to take your right hand and go ahead and place it over your left ear. So that way that right ear is getting closer to that right shoulder. Take a breath. Now we're going to extend this stretch even further. What I want you to do is put your nose up to the ceiling and extend that stretch in your neck and your shoulders. Can you guys feel that differently? And breathe. Okay, nose back down, hand rested, and then swing back around slowly and gently over to the left side. Go ahead and take your left hand, place it over your right ear, and then extend this here. And what we're doing right now is called range of motion exercises. And this helps to loosen the fascia that's in our bodies. Go ahead and lift your nose up to the ceiling. And the fascia is this thin area covering all your connective tissue, and it helps to keep the organs moving. When it's loose, it helps to keep the organs moving like they should, operating. Okay, nose back down. Release your hand, and then swing back down to the center, and then up. And the way that I think about fascia is, what I want you to do is take your nose and you're going to place it over your right shoulder. So we're looking over to our right. It's almost like when you crack an egg open, a raw egg open, and there's that thin, clear layer inside of the egg. That thin, clear layer is like our fascia, and it's on the inside of all of our body, right underneath our skin. So we do this back to center, and then we're going to go over to the left shoulder. And so we do these range of motion exercises to help loosen that fascia. So again, everything within our body is moving, working correctly. Our blood is circulating and pumping the way that it should. Back to center. One more time on each side. Over to the right. Now we're going to extend this stretch by placing your chin down on your shoulder. And as you notice, we lengthen the left side of our neck and shorten or contract the muscles on the right side, you can definitely feel more of a stretch, more of a pull there. Okay, chin up and back to center and over to the left. Breathe, chin down. Chin up, back to center. So now we're going to work on our shoulders, and we're going from head to toe today, guys. All right, so shoulders up. Another benefit of these range of motion exercises, in addition to loosening up the fascia, is it helps a lot with chronic pain conditions such as lupus. Shoulders up, shoulders still up. Okay, go ahead and drop those shoulders down. And also if you have arthritis and that kind of stiffening of the joints, because it helps to create more mobility in the joints, especially if you do have something like arthritis where you're used to keeping different joints immobile. All right, shoulders up and then shoulders down. We're going to do shoulders up one more time, and then we're going to do a little bit of a variation. Shoulders up. Okay, now roll it back. Roll it back. So Tracy from Cornwall, UK says that she just found me, and this is great. It is 9 o'clock at night. You go, girl. Thank you for still joining me. She says that she's aching and shattered, so she's going to save the video, do it in the morning. And I'm so glad that you are deciding to incorporate this into your morning tomorrow, and hopefully each person watching can incorporate it into their daily routine. So I'm rolling my shoulders back and continuing to breathe. Now what I'd like you to do is pause. Now roll your shoulders forward. If we can do these range of motion exercises daily, if we can do some sort of physical movement and stretching on a daily basis, not only is it going to help with our pain condition and help our bodies feel better, but it's also going to help with our mood, because physical movement and exercise actually creates the brain chemicals that help with depression and anxiety. It helps to release endorphins, which are the feel-good chemical in our body. It helps to also produce more dopamine, which is the neurochemical, the brain chemical that is associated with better mood functioning. All right, pausing right there. Now what I'd like you to do is place your hands on your shoulder, and you're going to push your shoulders back like angel wings or eagle wings. And we're going to go ahead and open up our chest, open up that heart center, and breathe. Okay, got that? Do it again. All right, now what I want you to do is bring your elbows together. Breathe. And although my elbows touch, yours might not, depending on your level of mobility and flexibility, and that's okay. Just do what is comfortable for you and your body. Listen to your body. All right, back out. Angel wings, eagle wings. And please note that if any time any of this causes pain and discomfort, then go ahead and ease off the movement or modify it in a way that works better for your body. Nothing should hurt while we're doing this. All right, elbows back together. Breathe. All right, now we're going to challenge ourselves a little bit. What I want you to do is lift your shoulders, your elbows up. And I misspoke and I said shoulders, because when you lift your elbows up, you feel a definite tension and stretching in your shoulder blades. Up, 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 up. Continue to breathe. If this is challenging, to just keep those elbows back down. Again, listening to your body. All right, and down. Now what I want you to do is turn to the right and turn to the left. So we're going to do these twists, which are so good for our spinal mobility and also just for like all this like low back pain and the areas that we may carry our attention in our body. So first I'm going to turn to the right. So I'm going to grab the side of my chair and I'm going to put my hand, if I can move my camera, over to the right side, my left hand on the right side of my knee. All right, and twisting and looking behind me, looking as far back behind me as I comfortably can. And if you guys were in the room with me, you would hear like, crick, 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 like all kind of cricks and cracks and stuff of my back. And so if you heard some of that cracking and popping and Rice Krispie treats, that's okay. That happens sometimes in our bodies. Just means we need to do these exercises maybe a little bit more frequently. All right, and over to the left, remembering to breathe. Another psychological benefit of exercise is that it also lowers levels of cortisol in our body, which is the stress hormone. And cortisol can definitely wreak havoc on our immune system and our mood and so many other things. So get moving in any way that you can on each day. So we're going to do that one more time. Twist to the right and twist to the left. All right, over to the right. Breathe. Okay, back ahead of you and to the left. Now we're going to move on to our hips. So for this one, I'm going to back up my chair so that you can see me a little better. What you're going to do is lift up one knee at a time. So right now I have my left knee lifted, and then you're just going to do small circles with that knee. Small circles. And we're rotating our hip flexors and increasing mobility in those joints around this area. Circles, circles, circles. I usually start in the clockwise direction. It's just what my body naturally does. But whatever direction you started is totally fine. All right, pause, and then go ahead and go in the opposite direction, which for me is counterclockwise. Again, feel free to leave any comments or questions in the comment box, and I will try to answer them as time permits. All right, pause. Go ahead and rest that knee, rest those hands. Take a breath. All right, now I want you to do the same thing with the left side. So go ahead and lift up your left knee and rotate, rotate, rotate. And it looks a little dark in here, so you keep working. I'm going to turn on another light. All right, rotate, rotate, rotate. So for this knee, I started counterclockwise or going out position. And I noticed for me that this is a little more difficult to do. I have more tightness in my left hip. You might notice that for you, that one side of your body has a little bit less mobility than the other. Just notice that. All right, pause, and then going inside. Rotate, rotate, rotate. Pause. Now we're going to challenge ourselves. And what we're going to do is, let me lower the camera down a little bit. We are going to lift both legs in the air, and doing this is going to help engage our core muscles. So go ahead and keep those belly muscles kind of tight as you're doing this. Keep them kind of sunken in, remembering to keep breathing. And what we're going to do is lift. Well, okay, I'll start a little bit of challenge, like not super hard at first. Okay, we're going to lift one leg up at a time. So go ahead and lift. See my toes, I'm not wearing any shoes. Lift up your right leg. Focusing on your breath. This is almost like a modified plank, but sitting down in the chair. And what you'll notice is that you may feel some stretching and tightness here in your thigh and in your hip. And all these muscles are now engaged in addition to your core, because we're keeping that belly tight. Now what I want you to do is point your toe. Notice now how there's more engagement of muscles, where you feel an additional stretch and tension in your calf muscles, as well as those thighs. All right, go ahead and release. When you're here, just go ahead and tap your toes. Toe, heel, toe, heel, toe, heel, toe, heel, toe, heel. So go ahead and loosen some of that up that we just did. All right, now we're going to do the left leg. Left foot up. Engaging those core muscles, keeping that belly tight. See if you can lift that leg a little bit higher. Woo! That was some tightness. Jeez. Keep going. All right, now we're going to point our toes to also engage our calf muscles. All right, slowly, gently lower. And then with your foot, you're going to do toe, heel, toe, heel, toe, heel, toe, heel, toe, heel. That's going to increase the range of motion and also just give that thigh and that leg a little break. All right, now here's where the challenge comes in. We're going to do both legs at the same time, modified plank, engaged core. All of our muscles are going to be engaged and tight and feeling really good, or maybe hurting a little bit, but again, not pain, just awesome engagement of physical activity. All right, both legs up. You may notice that with both legs, you're unable to put them up as high. Notice that my hands are on top of my thighs here, but you can also use the side of your chair to help brace you. All right, now what I want you to do is go ahead and rotate both ankles around. And so what you're doing is, backing up a little bit more, what you're doing is rotating those feet. And this is doing the range of motion for our ankles now, in addition to engaging all these muscles. And the important part of doing this engagement with the legs and the ankles in particular are for balance, because as we get older or as our bones weaken, depending on what medications we're taking and those kinds of things, the risk of falling increases. And so it's so important to develop those muscles in our ankles in these areas. Notice that I'm changing the rotation direction frequently to help develop some strength in those areas and increase our balance and help prevent the risk of falling. All right. So now what we're going to do is play the piano with our toes. This is where it gets fun, guys. So go ahead and play the piano. Do a little dance. Shake, shake, shake. And then what you're doing is, since we're near the end of our workout and we're going to end with some breathing exercises and me answering the questions, go ahead and do what else your body needs right now. So maybe your body needs a little bit more wrist rotation because you've been doing a lot of typing or texting. Or maybe you need a little bit more of a head rotation. because you hold a lot of tension in your neck. Or like me, you have a little kitten and an infant who's sleeping on you all night, and you're not in the proper position of alignment while you're asleep, so everything is all stiff and sore when you wake up, whatever the case might be. All right, awesome, really, really good job. We have just 5 minutes left, so I am going to check and see if we have any comments. Yes, someone said she has a neck injury. Can you do this? Lupus LA responded, always ask your doctor. Absolutely, yes, do that. And then again, if you're doing any of this, well, I'm out of breath. I hope you guys are out of breath too, and it's not just me. If you're doing any of this and you notice any pain or discomfort, again, ease up on the exercise and just focus more on your breathing, that diaphragmatic breath. Someone said they're loving this. How often would you recommend this exercise? I would recommend it on a daily basis. So some people incorporate it into their morning routine. Just before they get out of bed, they just do a little, stretching and movement of their neck, then their shoulders, then their sides, then their hips, and then their feet. And then you can also do some hand things as well. Some people do it at night to help usher in a state of relaxation and signal to your brain and your body that it's time to go to sleep. So whether you decide to incorporate it as part of your morning routine or in the evening, either is fine. Just make it a regular thing for you. And keep in mind that it doesn't have to take very long. I do have videos on my website that are 56 minutes long, so a very long and engaged chair yoga workout. And then we have like 10 minutes, or we can just do 2 minutes, whatever is going to work with your energy and your availability and your lifestyle. And like my mom says, aim beats name. So just doing anything is better than doing nothing at all. All right, someone said, thank you, definitely have a look. And depression, big thing with chronic pain, absolutely, absolutely. So what kind of chair is best to use for chair yoga? Any chair is fine. I'm just using my office chair here, and I have the arms lowered down. If you have like a dining chair that has no arms, that's great. If you're just on your sofa, then that's fine too. But ideally, you have a chair that is armless so that you can do more exercises, including turning all the way to the side and then doing a new twist this way. Which if you try this in your chair, you'll notice that it feels different than the front twist. It actually engages different muscles. Oh, that feels really good. Let's go ahead and do that, guys. Do that with me. And then go ahead over to your other side and going back. All right. What other low impact, no impact exercises should we do? Should we explore to complement this? Oh my gosh, there's so much awesome stuff. If you go to YouTube, there are other chair yoga videos on YouTube. There's also like chair salsa, chair merengue, where you're seated, so you don't have to worry about balance issues, and then it's also adaptive to many different limitations that folks may have physically. And then you can just do as little or as much as you want with the chair salsa. So just look those up. And again, start slow, and as you're doing it, listen to your body. I think that was it as far as the questions. So we are just about out of time. Let's use the next 30 to 60 seconds just focusing on our breath. And thank you guys so much for joining me today. So go ahead and either close your eyes or lower your gaze, whichever feels most comfortable for you. And I just want you to focus on your breath. Breathe in through your nose. Again, as if you're smelling a bouquet of roses. or like the freshest pizza or whatever you like. And then breathe out through pursed splits. Breathing out your pain, breathing out your discomfort, breathing out your stress. Just let it all go. Blowing out birthday candles. So again, breathe in, breathing in your peace, breathing out your stress. Now next time, as you exhale, I want you to say to yourself a word or a phrase which is calming and soothing for you. So you might say, relax, I am relaxed, or calm, I am calm. Just go ahead and inhale and exhale. Calm, I am calm. One more time, inhale and exhale. All right, very last part of the workout today, I'd like you to take your right hand, place it on your shoulder, and give yourself a pat on the back because you did a tremendous job. Thank you guys again so much for joining me. I will be back with Lupus LA later this month to talk about the mind-body health connection. Take good care, and www.drblied.com if you'd like to reach me or you have any questions.